Step 1. Check medication administration order against physician's order. Comparison helps to identify errors that may have occurred when orders were transcribed. Always remember, the physician's order is a legal record of medication orders for each agency. Step number 2. Know the purpose, action, adverse effects, and special consideration of medication to be given to the client. By doing this, having adequate knowledge helps you evaluate therapeutic effects, and it helps you educate your client about the medication. Step number 3. Prepare medication on a tray. Organizing things properly facilitates error-free administration of medication and could save time. Step number 4. Transport the medication to the patient's bedside and keep the medication in sight at all times. Careful handling and close observation of medication tray for certain patients prevent accidental or deliberate disarrangement of medication. Step number 5. Identify the patient by checking the identification band or ask the patient his or her name. This ensures that the right patient receives the right medication as ordered. Step number 6. Explain the procedure to the patient. As a nurse, you will gain cooperation from the patient's part and somehow lessen anxiety, thereby promoting effectivity of therapy. Step number 7. Fill securely the nebulizer cup with prescribed amount of medication. This ensures that the required amount of medication is exactly given. Step number 8. Turn on the power button of air compressor to ensure the efficient vaporization of medication to be given. Step number 9. Be sure to observe the fine spray from the nebulizer. It's a good way to check if the equipment is really working. Step number 10. Encourage the patient to breathe deeply the nebulized vapor via mouthpiece or mask, whichever is preferred. Breathing deeply can maximize the effect of medication as it travels directly to the lungs. Step number 11. Remain with the patient until all the solution has been nebulized. Or you may instruct the client to continue the treatment until he or she can no longer see a mist on exhalation from the opposite end of the mask or mouthpiece. Remember, lack of mist or vapor means that the client has not inhaled the entire dose of medication. Step number 12. Encourage the patient to expectorate. Applying half-cuff technique could be helpful. Just sit upright, breathe 3 times, bend arms, raise elbows, and hold breath. Exhale forcefully. This is to clear the airways, for medication had loosened bronchial secretions. Another technique which could be used is chest physiotherapy, which could facilitate expulsion of secretion to clear airways. Step number 13. Ensure that the patient is left comfortable as possible. Bronchospasm is further reduced if the patient is relaxed and reassured. Step number 14. Wash and dry the nebulizer cup, tubing, and mask used with warm soapy water. Then, it could be soaked with white vinegar and water. After that, rinse and dry. By doing this, it decreases the chance of pathogen to enter the respiratory tract. Step number 15. Retain the equipment in a polythene bag. Securely clean and dry equipment for next use can surely prevent infection. Step number 16. Document necessary things appropriately, such as nursing practice done. Any adverse effects or any abnormal findings should be reported immediately. After administration of medication, it is necessary to evaluate properly. Things to include are the following. Evaluate if there is increased expectoration, less labored breathing, lung sounds improved, ventilation improved,